Ladies and gentlemen, New York is now reaching out to the National Guard to replace healthcare workers. And they're also reaching out to people out of state to remedy the situation that they're about to get their state in. Now, I know some of you brought up foreign workers. This is not what this governor is talking. And foreigners are not the answer. And here's why I am telling you this. If foreigners were the answer, why do you have a labor shortage in America? You got millions of people in America that come from other countries. So if they were the answer, why are you looking at a labor shortage now with millions of foreigners sitting in America right now? I'm just saying. So let's get into this story that came out from Reuters September 26, 2021. New York may tap National Guard to replace unvaccinated health workers. Now, they are also talking about reaching out to workers in other states to come in to work in New York. Okay. New York Governor Kathy Hochul is considering employing the National Guard and out of state medical workers to fill hospital staffing shortages, with tens of thousands of workers possibly losing their job for not meeting Monday's deadline. And ladies and gentlemen, it looks like she's going to move forward with this thing. Now, even getting the National Guard and getting out of state workers, that's going to take some time. That is not something that's going to happen overnight. That's going to take some time. And you still may not get all the people you're looking for. So the plan outlined in a statement from Hochul on Saturday would allow her to declare a state of emergency to increase the supply of healthcare workers to include licensed professionals from other states and countries, as well as retired nurses. So she's really mainly looking for people right here in America. They're not going to be bringing in a boatload of foreigners like you think. Hochul said the state was looking for using the National Guard officers with medical training to keep hospitals and other medical facilities adequately staffed. Some 16% of the state's 450,000 staff and roughly 72,000 workers have not been fully jabbed. The governor's office said the plan comes amid a broader battle between the state and federal government leaders pushing for mandates to help counter the highly infectious Delta of the novel. We know what it is. So, Delta and workers who are against the vaccine requirement, some objecting on religious grounds. Hochul attended the Sunday service at a large church in New York City to ask Christians to help promote the vaccine. All right. I need you to be my apostles. This is what she said. I need you to go out and talk about it and say, we owe this to each other, Huckle told congregants at the Christian Cultural Center in Brooklyn, according to a transcript. She said, Jesus taught us to love one another. I don't know, Black people in the last 500 years, do you feel loved? I'm just asking, do we see love? I don't think, I haven't seen any. You know, I often used to wonder why these people reference Jesus and that false painting they gave us. How come they don't act like that? I was just always wondering that. That's why I used to tell my mother I don't believe this whole thing, because these folks aren't very Christ-like at all. They're not at all. And we don't see this in them at all. We don't see it. So, how do you show that love, but to care about each other enough to say, please get the jab seen because I love you and I want you to live? If y'all seen all this love, please post it in the comment section. This love must be invisible because nobody is seeing it. Okay, healthcare workers who are fired for refusing will not be eligible for unemployment insurance unless they are able to provide a valid doctor approved request for medical accommodation. This is what the governor is saying. It is not immediately clear how pending legal cases concerning religious exemptions would apply to the state's plan to move ahead and terminate healthcare workers. A federal judge in Albany temporarily ordered New York state officials to allow religious exemptions for the state imposed JABSIN on healthcare workers, which was put in place by former Governor Cuomo. And it takes effect on Monday. The requirements for New York City school teachers and staff was temporarily blocked by the U.S. Appeals Court just days before before it took effect. So the teachers were under the same mandate, ladies and gentlemen, and it got blocked by an appeals court. Interesting. Very interesting. A hearing is set for Wednesday, and that's in regards to these healthcare workers. The highly transmissible Delta has driven the surge in cases and hospitalizations in the United States that peaked in early September and has since fallen, according to a Reuters tally. So they claim it fall um, in September. So who knows? So let me just go down a little bit. While nationally cases are down about 25% from their autumn peak. How can it be the autumn peak? Autumn just started. Never mind. Why am I trying to figure these people out? They never make any sense. Um, Risking new infections in New York have only recently leveled off. And, that really don't mean anything because it goes down. Just like over the summer, they were in spring, it went down a bit and they went over the top, opening everything back up and it rose again. It never stays down. So even when it goes down, it don't stay down. Okay, so in an attempt to better protect the most vulnerable, the CDC on Friday backed a booster. But um, if you remember, the FDA rejected the booster for everybody, just for 65 and older. All right. So it includes people in homeless shelters, people in group homes, in prison. So, in other words, the kind of people that can't get away from them. That's really what sums it up. The kind of people that can't get away from them. That's who they're going after first. Okay. Walensky, hold on, decided to include a broader range of people than was recommended on Thursday by a group of experts outside of advisors to the agency. The CDC is not obligated to follow the advice of the panel. So, ladies and gentlemen, that's where it stands. It looks like, they may be moving forward to this, not unless an appeals court will put it on pause like they did for the teachers in New York. So we shall see what happens. This definitely will be interesting to see what happens in New York. I just don't know how much of the National Guard they're going to be using for things, and just trust me, it's not going to be just driving school buses and healthcare. It's going to be other areas where they're going to be demanding the National Guard because they're just not finding enough people to take these grossly low paying jobs in America. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.